Welcome back to TV5 News at 9, and it's time now for Aging in Style with McLaren. Joining us today is Dr. Hesham Gayar. Thank you so much for joining us this morning. We appreciate it.
My pleasure.
You are welcome. Okay, so today we are talking about getting cancer treatment during this very difficult time. Now, your team at McLaren is still treating patients right now, so what should someone consider before they delay treatment?
Well, it's very important, and thank you for asking the question.
Sure.
Cancer treatment is very important, and we all understand there is kind of concern about coronavirus or COVID-19. However, I wanted to elaborate on the point that continuing your treatment or your investigation for cancer or starting your treatment is more serious, and the risk on your life is more significant for delaying the treatment, cancer treatment, than coronavirus itself. Saying that, it is very important to know that you're totally protected when you come to our center. If you are concerned about coronavirus, the Cancer Center is not treating patients with coronavirus and is totally isolated away from the other areas doing so. And nobody enters the building, be it workers, healthcare workers, or patients, without being screened to make sure there is no suspicion even for coronavirus. And everything is properly cleaned and the hygiene is very high. All common services are frequently cleaned to make sure. And we haven't had any infections or any cases diagnosed on those being treated. So it's a very safe environment.
That's great to know.
Still,
yes,
very important to continue your treatment or start it.
Yes.
And if you started investigation, please do not delay it.
Okay, that's perfect. And also, doctor, are people with cancer more susceptible, and how are you helping them to stay safe?
Thank you. Yes. The reason why we're doing all those precautions and screening everyone coming in and out of the building is because some of our cancer patients are more susceptible to infections, and they will be at risk if they are exposed to coronavirus. For that, we have to protect everyone, patients and workers in the facility, to make sure that risk is eliminated or reduced.
Now, you're the director of the McLaren Proton Therapy Center, and that's in Flint. Tell us about that and the importance of proton therapy.
Well, proton therapy is a very special radiation treatment. It is the top-notch radiation treatment in the U.S., the latest and greatest, and especially by ability to spare normal tissue. Healthy tissue can be spared, and the radiation is focused only at the cancer. Normal radiation goes through the body, but proton stop at the target and diffuse the majority of the dose, and we have spots that are laid exactly where the tumor is. And we have imaging system, three-dimensionally, that can visualize where it's going just before the treatment. But the beauty is the physics of proton. That's why the center is so expensive. Those proton therapy are stop where the target is and does not continue treating normal tissue past it. So that's the main advantage of proton therapy.
And it's the only center of its kind in mid-Michigan. We're so happy to hear that. Tell us also, doctor, when would you use proton therapy? Breast cancer, would that be an option?
Yes. First, regarding its position in Michigan, our proton facility is one of two in the state of Michigan and is the largest and most advanced. So there's only two centers in Michigan, and ours is the largest and most advanced. And we're actually starting a second room in the near future for adding. So we're expanding, we're doubling the current capacity because we are at capacity. We're treating to almost midnight with one room. So let me restate that last sentence. We currently are treating almost to midnight. This coming Monday, we're adding a second room that will give us double capacity and will be the largest center in Michigan treating proton therapy.
And doctor, you can use it also for breast cancer. Is that correct? Tell me about proton therapy and breast cancer.
Proton therapy can be used for many cancers, and it shines when the cancers are close to critical organs, because you can avoid that critical organ completely. For cancers in the head and neck, in the brain, in the base of skull, in the thyroid, in the neck, cancers in the chest, close to the heart, lung cancer, esophagus cancer, lymphomas in the chest. Breast cancer in particular, as you've asked, is very special because with normal radiation, with the standard radiation, we cannot completely avoid small doses going to the heart. But with proton therapy, you can treat left-sided breast cancer, cancer of the left breast, with completely avoiding the heart, and reducing the dose to the heart reduces the risk of secondary effects and problems with the heart later on, like heart attacks and other heart diseases are reduced. So it is much safer to be used, especially on the left breast, compared to the standard radiation.
So you can use it for a wide variety of cancer. That's great to know. Also, doctor, tell us, how can people get more information about proton therapy in your center?
Yes, and we didn't mention the pelvis and the back of the abdomen, and any of the organs could be treated with proton therapy, especially if there are sensitive organs around, and especially for younger people who are more at risk for late effects and the quality of life. So the main advantage of proton therapy is it reduces side effects and makes the quality of life of people better. Also, patients who have cancer treated before with radiation can be retreated with proton therapy, while it is not the case for the conventional radiation. How to get a hold of us or how to reach us is you can call 855-MY-PROTON, or you can reach us on the net by mclaren.org/proton therapy.
Oh, that's great to know. Great information. We appreciate you stopping by and calling in today, Doctor.
It is my pleasure, and thank you very much for helping spread the news about this technology and to encourage patients to come and continue their treatments and not to worry about coronavirus.
That's right.
In this pandemic.
A lot of people haven't heard about proton therapy, so it's good that you stopped by. Thank you so much. And thank you again. If you want any more information, check out the Aging and Style section of WNEM.com.